And here is your question.
Okay, consider sharing an invitation. Okay.
Yes, just stop maybe something. 6 seconds left, then I'll.
Okay.
Okay, now, please. All right. So if you've read and understood, considering it surgical anatomy, please tell me, after you've read the stem, what might be the provisional diagnosis you'll consider or think of?
Top differential diagnosis is parotid carcinoma, cystic adenoma.
Yes.
The other, it could be submandibular tumor or thyroid cancer.
Okay. Please tell me the about the parotid gland, the structure, the
Parotid,
anatomy of the.
parotid gland is a serous salivary gland.
Yes.
Ana- present anatomical surface is anterior to the ear. The anatomy landmark is head of the mandible
Okay.
to the and the tragus of the ear, and 2 centimeter under the mandible. Also, the mastoid process. The superior border is between the head of the mandible and mastoid process. Posterior border is from mastoid process to 2 centimeter below the mandible angle. Anterior border is between the head of the mandible and 2 centimeter below the mandible angle. Also, there is a duct of the parotid gland.
Yes.
That landmark called Stephen duct.
Please, if you could tell me the surface anatomy of the parotid duct.
Parotid duct, it is from the frame angle of the mouth to the tragus of the ear. In the middle of this line is the parotid duct. Opening
Third of.
at second, middle third, opening in the opposite the second upper molar.
Please tell me the blood supply. Now I said blood supply, both arterial and venous of the parotid gland.
Blood supply of the parotid gland, it's from the external carotid artery.
Yes.
And the venous drainage by retromandibular vein.
And the lymph drainage is done where?
Lymph node, is it within the gland and to superficial and deep cervical lymph node.
Please tell me, okay, the nerve supply. The
nerve
gland gets its innervation from where?
salivary gland innervation.
What type of secretions does the parotid
serous secretion.
Okay, please tell me what are the structures which pass through the from superficial to deep through the parotid gland?
Facial nerve and
facial nerve, yes, and its branches.
And
yes,
its branch and external carotid artery.
Yes, and its 2 terminal branches.
Terminal branches,
very important. Yes.
Yeah, and superficial and maxillary.
Yes.
Also, the lymph node.
All right, and
auricular nerve. And greater
vein.
auricular nerve.
Okay, greater auricular nerve, and then
retromandibular
vein and superficial temporal vein.
Yeah.
Okay, right. What happens? Okay, the innervation is by parasympathetic ganglia supplying the parotid gland through optic
Okay.
ganglion. Okay.
Oh,
What
about optic
happens?
ganglion,
Yes,
yes.
this is now important. What happens
Yeah.
when this innervation gets disturbed or knocked down?
It's called disturbed in Freyer syndrome, where
Yes,
the parasympathetic fiber is
yes.
regenerated and fused with a sympathetic fiber of uh, greater
Auricular.
auricular nerve,
Yes,
sympathetic fiber that supply the skin, lead to gustatory sweating and flushing of the skin around the
yes.
Parotid gland.
All right. You told me because of this lump, you'll have the differential diagnosis as, okay,
Yeah,
if there is swelling of the parotid region, what
yeah.
are the differential diagnosis you'll consider?
Most common tumor of the Parotid gland is pleomorphic neoplasm, which is benign.
Uh,
Also,
bring, like, mention the most common thing first.
most common
Infection,
is pleomorphic neoplasm, infection, parotiditis, and
mumps in
adenocarcinoma.
children. Okay.
Yeah, infection, parotiditis, and mumps, and
And
could be uh, 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 tumor or infection or
wait,
neoplasm or
and
adenocarcinoma
the most
and
common obstruction because of
uh,
stent,
obstruction
calculus,
of the stone. Yeah, stone or calculus of
calculus.
the
Yes.
yeah duct,
So,
parted
all
duct.
right, which you said, which one is the most common neoplasm? Pleomorphic
Pleomorphic neoplasm,
adenoma. Okay. What is
adenocarcinoma.
Barton's tumor? Please define Barton's tumor.
Wharton tumor is a local malignant tumor of the parotid gland.
Okay. Locally advanced tumor.
A local advanced tumor is.
Okay. What else is significant when it comes to tumors in human beings? It's the lifestyle and
Yeah, cosmetic and also it invade the facial nerve. It could be affect the facial nerve and facial expression.
when it's
Yes.
invades the facial nerve, then
The
it's
facial nerve.
definitely
Yeah.
carcinogenic. Please tell
Yes.
me what kind of image are you looking at?
This is could be angiogram.
What exactly
Angio
are you looking at in the image?
maxi uh, maxillary artery
Okay,
and and uh, and
are you
uh,
looking at maxillary artery?
yeah, and maybe peripharyngeal artery of external carotid artery branches.
Yeah, branches. Is it showing anything to you? Is it of any significance? Why would you ask for this sort of investigation, this sort of
Okay,
imaging?
this is the duct of the Parotid gland.
Yeah,
Yeah, oh, cyelogram.
and it's
Okay,
xylogram. Yes.
yes, cyelogram.
So,
Yeah, yeah.
do you find obstruction anywhere?
No, I didn't see it.
No.
Yeah,
Yes, but
there's
that's
no
what it is.
obstruction.
But
Oh,
you suspected obstruction because of the swelling.
yeah.
Right. There could be causes of, okay, they say gustatory sweating is because of Graves syndrome. What are the malignant, okay, primary and secondary causes of parotid swelling?
It could be the lymph node enlargement. Could be a lymph node enlargement
Okay,
due to lymphoma and leukemia.
all right. And you have to tell me which cranial nerve is responsible for supplying the parotid gland?
The cranial nerve,
9.
yeah, glossopharyngeal.
Okay, and it was very strange the way you told me the anatomy of the surface anatomy of the parotid gland and the duct, because, okay, what could they show? They could show you a pathology slide with pigmented cells, and that would be melanoma,
Mhm.
metastatized melanoma, an exam.
Yes. Okay.
Okay, what might be the causes of restricted movement of tongue?
Restriction movement of the tongue could be congenital or affection of the glossopharyngeal nerve, or hypoglossal nerve,
What is
or
the
traumatic.
glossopharyngeal nerve? What does it do?
Glossopharyngeal nerve, it supply the pharynx
Yes.
and muscle of mastication.
Which muscles?
Palatoglossus and styloglossus.
Okay.
Oh, it's the bimandibular nerve, I think.
Yeah, you're mixing up. Thank you.
Yeah.
This needs to be revised.
Mm,